Our plan will involve 3 steps, starting with easing restrictions on activities and situations that have been shown to be lower risk throughout the pandemic. The first starts with children and youth. Step 1 will remove almost all restrictions affecting children, including removing the mask mandate for all K-12 students effective this weekend. Outside of the school setting, kids 12 and under will now be exempt from the general mask mandate that will continue to apply in indoor settings for approximately 3 weeks to come. As I have long said, kids have been subjected to a heavy and I think unfair burden throughout the pandemic. And it is given the very low threat that COVID-19 poses to the health of children. It is no longer justifiable after 2 long years to continue to disrupt and restrict the normal lives of kids. It is time to let kids be kids. And I am determined to ensure that should we ever have to come back to any kind of measures in the future, God forbid, that we will not affect the wellness, the freedom, and the normal lives of kids. Step 1 will also end the restriction exemption program in its entirety, effective midnight tonight. I wanted to say this about the restriction exemption program. We brought this in September when our healthcare capacity was under very severe stress, particularly in intensive care. And at the time, we saw that 90% of our new ICU admissions were amongst unvaccinated people, and the province was generally under-vaccinated relative to the rest of Canada. We simply had to do something urgent to prevent a catastrophe in intensive care and in our hospitals generally. And we had to do something to get our vaccine rates up. And so we chose a measure that avoided shutting down businesses and places of worship, but allowed us to reduce transmission while also seeing a significant increase in vaccinations. We went from about 75% vaccination rate to now 90% on first dose, and we went from 68% to 87% second dose coverage. That has made a huge difference. It has saved many lives. And at the same time, we have seen a change in transmissibility. The reality is that with the high level of infectiousness of the Omicron variant, plus the waning protection from infection of a second dose, most Albertans got their second dose 8, 9, or 10 months ago, we have seen that that vaccinated individuals are still at a high risk of Omicron of infection, not of severe outcomes, not of severe disease, but of infection. And so the point is simply this, that the restriction exemption program has served its useful purpose. It's done its job. It is no longer leading to higher vaccination rates. In fact, we have seen our vaccination rates effectively frozen since early December. And so our approach to COVID must change as the disease changes. And I believe that's exactly why the Chief Medical Officer for Canada, Dr. Tam, recommended earlier this week that provinces re-examine programs like their proof of vaccination programs. That's exactly what we're doing with this decision. Finally, step 1 will remove capacity limits for all except large capacity venues of over 500 people. Minister Copping will provide further details on these measures. Now, following these phase 1 measures, we will take 3 weeks to carefully monitor trends with a focus on hospitalizations. If and only if we continue to see a downward trend in hospitalizations, we will then proceed to phase 2. Our current target date for phase 2 is March the 1st, at which point we plan to lift most remaining restrictions, including the indoor mask mandate, the requirement to work from home, and remaining capacity limits. Following this stage, we will take more time to monitor trends, again with a focus on whether pressure on our hospital system is manageable. When it is safe to do so, we would then proceed to stage 3, which would be to eliminate all remaining public health measures at that point. So let me add an important caveat. If the current trends reverse themselves, and if we see a significant and sustained increase in pressure on our hospitals, we may have to pause some of these measures. But we are determined to get our life back to normal, doing so in a way that ensures that a hospital bed is there for everyone who needs one. In the past, we have tolerated certain municipal bylaws on public health matters. We've tried to be collaborative and respectful. And as you know, we do try to respect as much as we can the delegated powers of municipalities. But I'd really like to have a longer conversation with particularly the big city mayors who have spoken to this issue, because I'd like to know if it is their intention to create an entirely separate municipal public health policy that is different and apart from that of the province. I think that would be a serious problem. And so that's something that we will talk to them about. We'll be listening to Calgarians and Edmontonians on this issue. We haven't made any decisions, but I would just say this. I think turning a public health policy like this into some kind of a local political football is not helpful. It's not conducive to public confidence in the public health parameters, or in the clarity about what the rules are from one part of the province to another. And finally, you know, it's the province is responsible for administering the healthcare system, which has got to be the central focus of all of this. And I think perhaps we've been a little more sensitive than some of these voices in municipal government about the damaging effect of restrictions. We are responsible for balancing all of these different considerations. Happy to have a respectful discussion with the mayors and others about this, and to look more closely at the issue, but we're keeping our options open. You know, everybody's got some grievances about policy, about the opinions of relatives, I know friendships that have been broken up over this. I know families where close relatives are not talking to one another anymore because of differences in COVID policy. I hear every day about physical altercations in stores and restaurants over things like masks and proof of vaccination. This is one of the tragedies of this terrible 2-year period. You can't really quantify it, but we all know it's real. I guess what's happening right now with these protests and the reaction to it is just an example of that. So I've tried to say all along that we need a lot of patience for one another. And I am concerned about this. You know, I see some of the commentary from people who are opposed to lifting the restriction exemption program. I've seen the following kind of comment a lot on social media lately. People saying, well, I don't want to go to a restaurant and have to sit next to somebody who's unvaccinated. That sentiment deeply concerns me. Treating fellow people as though they are somehow unclean. Listen, I've been amply clear that I think everybody should avail themselves of the protection of safe and effective vaccines, and that the choice not to get vaccinated is not just a personal choice. It does have social consequences, but it's never okay to treat people like that, to stigmatize people in that way. In a way, it kind of reminds me of the attitudes that circulated in North America in the mid-1980s about people with HIV/AIDS. That there's this notion that they had to be kind of distanced for health reasons. Listen, this is a terribly divisive attitude. So yes, we encourage people to get vaccinated, but treating people who have made a different decision as though they are unwelcome as members of our society is not acceptable. And on this, I would join the chair of the Quebec Liberal Caucus in calling on the Prime Minister to tone down some of the divisive rhetoric. One of the first and most important responsibilities of the Prime Minister is to be a uniter. Now, of course, we can't get past all of the differences of opinion and divisions on COVID policy, but surely the Prime Minister could find it in his heart to stop categorizing millions of people with terms like misogynist and racist. I think that's putting fuel on the fire of the social division, which we need to heal from and move on from.